Hello. Can you guys hear me?
Yes, I can.
Guys, please turn on your videos. It's good to put some faces to the voices to the faces, faces to the voice, however it goes. Make sure your video is on, at least for this call, if you're not on a phone, and definitely not in shower.
Unfortunately, I'm listening to my phone.
That's fine, Doc.
I don't have my...
Yeah, if you can come on the video, that'd be great, because I spoke to most of you. I just want to make sure have a good look at all of you, at least today. I know that you may not be on video all the time, but at least for this class. I mean, not class actually, this is going to be a quick call. We're not going to be teaching anything. So we'll just give a couple of minutes for everyone to join, probably another 2 minutes, and then we get started. Yes. This is a quick call. It'll probably end in, I mean, I see like there are 12 plus 4, 16 folks should be on this call. So we're not going to be here more than probably 15-20 minutes today. But I normally do this introduction call because I really want to set the tempo of the course, and the whole rhythm of the course goes with what you will be hearing, because most of your questions as new folks who enrolled in the course will be in the first few initial days. Some of you might be having emails after emails with all the nitty-gritties. So just to avoid all this, even though we have recorded all this kind of sessions, I would like to go live and kind of go over how to navigate the course, what are some of the suggested or recommended do's and do nots. I don't have a long list. I'll keep it very simple and easy for you to do it. I just have one suggestion, one recommendation for you when you get started in the next 2 to 3 weeks to do. So I'm not going to bombard you with the rules and regulations. I'll just keep it very simple to 1 or 2 things that really helped other students who went through the course with us. So that's the whole agenda of today. Again, the most important thing that I would like to know is to kind of get to know you, because this is your time of kind of introducing yourself. We need to know, even though I spoke to most of you one-on-one, I would like to know your name, your highest education, your location, and how did you come to know about us? Like, the person who referred you, or you came to know through online search. However, you kind of went into the webinar that I did probably, and maybe some of you attended Dr. Satya's webinar or Shalini's webinar. Whichever way you did a webinar and you kind of got the information, and then we had a conversation regarding why, what was your objective of doing this certification program and all those things. So those are some of the things that we're going to cover today. So in the interest of time, before I can call anyone's name, I still see some of you are still dialing in. So let us start with I don't know how to do. Maybe we can go in alphabetical order. I don't know. Maybe I'll just call out names here. I guess that's easier. Let's go with Geeta. I'll just go in a circle.
Sure, sir. Good evening, everybody. Myself, Dr. Geeta. I'm a dentist by profession, but I also have a master's in healthcare administration from Canada. I came to know about MediPharm Solutions through Dr. Satya. She used to work with a dentist of my the same dentist that I know. I met. So, anyways, I live in Houston, Texas. It's really nice to be here. Hope that I'm done. Thank you.
Awesome. Thank you. Shweta, how about you?
I'm Shweta. I have PhD degree in life sciences. So I live in Cincinnati, Ohio. So I came to know through a friend. So that's it. Thank you.
The name of the friend?
Like I came to know through my husband, then he came to know through a friend,
Okay.
Atish.
Awesome,
Maybe
awesome.
he knows someone who works in media solution that I don't know.
Okay, got it. Thank you, great.
Thank you.
Robin, you're on mute. No, you're still on mute.
Okay, sorry. I'm Robin. I have a doctor of pharmacy. I'm a clinical pharmacist, and I'm from Somerville, Massachusetts. I've been thinking about career change for a few years now and getting into industry. And I can't remember exactly how I came across this, but I'm sure it was through some sort of internet search and it came up. So I'm
Awesome.
glad I found it.
Awesome. Thank you, Robin.
Yep.
I'm sure it's not Ron Patel, but what's your name, Ron Patel?
No, my name is Asha.
Asha. Okay, Asha. Who referred you, Asha?
Bindya Patel.
Bindya. Yes, I spoke to you and your husband, I guess. Yeah.
Yes, and that's his computer. That's why I think.
That's fine. So go ahead, please.
All right. So I live in Savannah, Georgia, and I did my master in English literature, which is totally different than what everybody else did it. But I wanted to choose something different now. So I was like, let me go ahead and try something different. So that's why I'm in this field.
Awesome. Good to have you. Parth.
Hi, yeah,
Go ahead.
my name is Parth. I pursued medical degree and I am currently living in Chicago. I think I found MediPharm through Google search.
Google search. Awesome. Okay, we need to connect. I need to call you out probably tomorrow. Okay, Parth?
Sure.
Awesome.
What time do we need to schedule something or?
No. I will call you. We'll figure out some time. Okay.
Perfect. Thank you.
Awesome. Jaya. Jaya, you're on mute. Guys, unmute yourself.
Hi, good evening, everybody. I am Jaya Banerjee Chatterjee. I have a doctorate in pharmacy and also a master's in chemistry. I connected through Dr. Pitti through LinkedIn, and I live in New Jersey.
Awesome, New Jersey. Nice. Rajesh.
Hi everyone, my name is Brijesh Patel and I completed my dental from India and I did my Masters of Public Health from New Jersey, Fairleigh Dickinson University. I currently live in Jersey City, New Jersey.
FDU, that's where I went for Masters in Public Health.
Oh, okay.
Teaneck campus.
Teaneck campus, the same campus, yes.
I used to work in Dunkin' Donuts on Cedar Lane.
Oh, okay. I used to go to that Dunkin' Donuts, yeah.
Yeah, I quit long time back.
Definitely.
Well, who referred you, Brijesh?
Khushbu
Patel. Yes. Okay, good.
Nice to meet you all.
Nice to meet you.
Do you still have some coupons, Dr. Pitti?
I will. I mean, if you get late to the class, you'll be buying coffee to everyone. Kevin, how about you? Kevin, you're on mute.
I'm Dr. Kevin Stone. I live in North Carolina. I currently, I was referred to by one of your students right now, Rojas Salazado.
Yes.
So did a lot of things. Did pharmaceuticals, did quality control, work with the FDA. And Rojas told me about this program. So it sounded very good. So I'm here.
Awesome. Good to have you, Doc.
No
Shruti.
problem.
Hi, my name is Shanti Shruti. I finished my MBBS and MD Ophthal from India, and I moved to the US for personal reasons, and I'm looking for a career change. And I came across MediPharm Solutions through internet search. Yeah, I live in the Bay Area of California.
Bay Area. Okay, Aftal, okay. 83834, because that's a number. Guys, write down this number and start calling from today, because I don't know who this person is. 834-391-0451. I'm just kidding. Go ahead.
Hi, my name is Mrinalini Nanuru, and I have been working as a pharmacist for past 7 years, and I do have some sort of experience in clinical research from India, and I do have a master's in health service administration. And right now I'm looking for a career change in clinical research.
Oh, okay, got it.
And I came to know about MediPharm through Google search and also attended webinar by Dr. Satya.
Awesome. Mrinalini, good to have you. Ken?
Thank you.
Ken.
Hi, everyone. My name is Ken Weke. I'm a foreign trained physician. I live in Chicago, Illinois, and I was referred to this class by a friend, Daisy.
Daisy?
Yeah, Ada or Daisy.
Ada. Okay.
Yeah.
Okay. Awesome. Mohammed, I think it's Amar, right? You're on mute again.
So my name is Mohammed. I'm a medical doctor from India. So I did my master's in human anatomy and physiology, and then I want a career change now. And my friend's friend referred to me, Subhashini. She referred me to the Abhishek sir.
Awesome. Thank you. Good to have you.
Thank you. Thank you, everyone. Yeah.
So the phone number starting with 857, please go ahead. 857-312-7928.
857. Yes, good afternoon. My name is Dr. Legrand, and I am a physician from Haiti. And I also, 30 years ago, I came to America, and I'm also a clinical pharmacist from Massachusetts College of Pharmacy. And I also have I have two masters, one in clinical mental health and one in psychopharmacology. And I was referred by with Kadish, which she's also in the program. But okay, a friend of hers tell us about it, and then we decided to do it together.
Awesome. I know that it's Kadish is also here. Emil Kadish, you want to introduce yourself as well?
Yes, I'm sorry, my video has to be off. I'm in Uber going home from work right now. I'm sorry, I won't be able to be
That's fine.
on camera. My name is Emily Kadish. I have an MD degree and I live in Massachusetts. I know about the program. I spoke to you last year together with my friend Rachel Rivers. She went ahead and went to the program. She finished, I believe, last year. And I was still debating whether I should change or not. And when I met Dr. Legrand, I spoke to him, and he encouraged me. So we're gonna take the class together.
Awesome, good to have you. I did not know I spoke to you last year, actually.
Yes, we spoke. You spoke to me and my friend Rachel. Rachel took the program.
Yes, Rachel Agabato, right?
Yes.
Okay, now I remember. Okay, good to have you both. Prasanna.
Thank you.
Hello, everyone. I'm a
Christina.
PharmD. I've worked for 15 years in retail and decided that it's time for a change in careers. It's been a journey, and I look forward to what's to come.
Awesome. Who referred you, Christina?
I actually saw a Facebook ad.
Oh, Facebook ad. Okay. Awesome. Good. Prasanna, are you there? Pawan. Prasanna, Pawan, who's going to go first?
I can do.
Go ahead.
Myself is Yeah, myself is Rebu Prasanna. I'm actually from India, but now in San Antonio, Texas. My degree is like a master's in microbiology. I had experience as a quality control, but now I want to pursue a new career. So I was trying to look for the options, and I came across MediPharm Solutions through Google, and I gave call to Dr. PT, and I attended the webinar of him, and he gave me the good look into it, and I started. I'm looking forward for more to have into it.
Awesome.
This is my, yeah. Thank you, sir.
Thank you. Pawan? I don't know who Pawan is. I don't have any Pawan. Pawan, you're on mute if you're talking. Let's keep going. Eti?
Hello.
Yeah, Pawan.
Yeah, hi, Dr. Pitti. This is Jalajakshi. That is
Oh,
my husband.
Jalajakshi. Oh, okay.
He opened. Yeah,
That's fine.
it
That's
is his
fine.
phone.
That's
Yeah, hi. My name is. Yeah, good evening, everybody. My name is Jalajakshi. I did MBBS from India, so I didn't work here after I moved to US. So I wanted to start my career on clinical research side. So I came to know MediPharm Solutions through Instagram. I was scrolling down, so I saw your ad actually.
Wow, Instagram.
Then I registered, yeah, and then I attended Dr. Satya's. I listened means I recorded a video. So
Awesome. Good to have you.
yeah, thank you.
Eti, how about you?
My name is Yeti. My full name is Yetunde Ilawale, but you could call me Yeti. My background is social work. I have a master's in social work from Walden University, and I wanted to looking forward to a career change, and I got to know about MediPharm Solution via Google too, and I searched for it, and I had various options, but my mind just picked this one, and I called in, and I was told about the webinar sessions, and I attended it, and it sounded interesting. And yeah, here I am today.
Awesome. Good to have you. Michael? Michael, if you're talking, you're on mute. Let's keep going, guys. We have 3 more. Michael?
Hey, can you hear me?
Yes, Doc.
Oh yeah. So, yeah, my name is Michael. I currently I'm in commerce and have a doctorate in pharmacy, and I've got to find out about the program from Google.
Google, wow. Good to have you. Good. I know you're at work, so you can just
Yeah.
I can sense it. Sharon, how about you?
Hello, good evening, everyone. So I have a background in pre-medical studies, and I have my master's in public health on a global health track. I also am certified in functional nutrition and herbal medicine. I also have a background. I've been trained in clinical research. So basically what I did was I did a specific Google search online for pharmacovigilance and drug safety, which is what I was interested after I completed my clinical research training. And I came across a couple of programs, as Yeti mentioned, and I just decided to go with MediPharm. And I was really happy when I attended the webinar, and you were very informal with, explaining everything, and you were always there to answer questions. So I felt very comfortable with joining this program. And I am also located in the city of Philadelphia in Pennsylvania.
Okay, good to have you, Sharon.
Thank you.
Dr. Gala. Doc. Doc. Go ahead, please.
Hi everyone, my name is Dr. Gala. I have a doctorate in pharmacy as a doctor of pharmacy, and I have some experience in clinical research as a data manager. Um, I heard about this opportunity from a friend of mine, Dr. Arugo, and I decided to, give a chance about this opportunity. And I'm looking forward to getting started and learning. Um, so yeah, I'm based in Georgia currently, and I just can't wait to get started.
Awesome. Thank you, Doc. Thank you. So I believe, thanks for that. I believe we covered everyone. If you're not talking, please mute. We just need like probably another 5-10 minutes and we'll be out of this call. So what I would, as I alluded to you guys earlier, it's actually a huge responsibility and a privilege to have all of you in this batch. And again, there are folks in this call who are in drug safety and pharmacovigilance, and there are folks from clinical research, and there are folks from clinical data management. I believe data management is next week, so it's only clinical research and drug safety. So which program you enrolled in. Again, I welcome everyone. And I wanted to share a very simple story with you about what goes on with MediPharm Solutions and how not just myself, because I kind of take a lot of responsibility in kind of doing the webinars, doing the classes and all those things, but it's never a one-man show here at MediPharm. There are a lot of folks that work along with me. I just happen to, kind of represent them in the best form I can. So the point I wanted to I think I have to mute everyone. Sorry guys. You can unmute yourself if you want to. The point I wanted to get across is the next, I would say 2 to 3 months, depending on what is your objective of doing this course. The one thing and the only thing I would recommend, I would have sent an email with the same recommendation or suggestion. But I think when you go live and when you talk to folks face to face, it has a different appeal to it. And that is the reason why I take time in doing it. The only thing and the only suggestion I have for you, even though life comes, life happens time to time, is to attend the live classes. That is the only recommendation I have. I have seen that really pay dividends when you guys come into job placement, when you go into interviews. You can always learn the subject. You guys have done a lot of education to this point that I don't think learning is difficult for you. You can learn anything that you put your mind to. But I believe learning is different from applying and thinking the way we think. If I am in pharmacovigilance, Satya is in clinical research, we get paid. What we get paid is because of not what we know, but what we are doing and how we think. So that knowledge, I would say knowledge transfer happens very easy. I would say its subject is always there. I've been doing these classes for like almost 10 years to this 25th of October. So teaching clinical research or drug safety or data management is very easy. I would say, I can pick up any topic at any given time and I can run through the modules, run through the presentation, and the knowledge transfer happens much easier. The point why I recommend you to attend live classes is, number one, the basic requirement of you getting a job. Like I always say this in the first enrollment webinar as well. The objective of any of our programs is job placement, is having a career through us. I don't want you to say that, oh, I got a certification. Yeah, that's great. That is, if that is what you wanted, great, you will get it. But I believe a long-term impact on you will be left if you are able to get a job and have a career through us. So we will leave a kind of a lifetime legacy with you in terms of how we were able to change the trajectory of your careers. So that is the reason why we exist in the first place. So to do that, I believe knowledge transfer happens much easier. But what I struggle with is the mindset, the way we think. And not just from a subject standpoint, but what you believe in and what you believe in yourself And those are the things that will not happen in over a period of 3 months. It is something that will take more time. And I want to give you 100%, more than 100%, to make sure you come out of this course, you come out of this certification program, not just with subject knowledge, not just with how to apply the subject knowledge, but to have a belief that, okay, this many students have done this course and they have already secured jobs, they already have careers. Like I think on Thursday, we have one person in clinical research. She has done the course and she's in the industry for 8 years now, and she got promoted to she got promoted as a director. She's going to come on the call, and you can imagine 8 years ago when she started the program, she did not know that she's going to come on the call on Thursday to kind of speak to the students. And that is the way that I just called her. I said, hey, can you come on the call? I need you to talk to the students. And she graciously accepted. What I want you to understand from that call or this kind of calls is, that is what I want you guys to do 8 years from now. So to do that, subject is there, but I want you guys to have this confidence, not just getting motivated, but I want you to make sure that when you go into your job placements and do your interviews, you got to shine through it. And that only comes when you start plugging into the live calls, engage in the live calls, and kind of ask questions as you go along. And again, some of you are faster in learning, some of you are slow, but in my experience, by the end of second, third month, everyone will come into the same on the same page, and you kind of will understand how this whole course works. In the initial part, you might have some bumps along the road, some technical things here and there, how to log in, how to do the course, all those things which I'm going to explain in a nutshell here in the next 5 minutes. But I just want you to prioritize the 2 hours. I don't want you to do anything for the next 4 weeks. If your course is for 3 months, for the next 1 month, until November 15th, let us put it that way, until November 15th, if you don't do anything and you have to do one thing, that is to prioritize 2 hours a week. If it is clinical research, it's 8 to 9 Tuesdays and Thursdays, 8 to 9 p.m. Eastern. And if it is drug safety and pharmacovigilance, it's the same Tuesdays and Thursdays, 7 to 8 p.m. We are not going to change the timings. I would say all our classes will be the same time. If it is clinical data management, it's Mondays and Wednesdays at 8 to 9 p.m. So you got your 2 hours. So just block off that time. Try to, kind of stay in the class. I know, you may have work in the evening sometimes and you may not be able to plug in. Understand exceptions happen, but try to be in the classes as much as you can so that you will kind of get the benefit out of having a live class than recorded versions. And we can go into the recorded versions. You guys can review the videos n number of times, and you can do the assessments and all those things as I'm going to show you now. But that is the only thing that I would like you guys to prioritize and attend the classes. So with that being said, let me go into the course navigation itself. So I'll take you through a screen. I'll kind of screen share and show you how you can complete the course as you go through the live classes, and then we take it from there. So let me stop this recording so this does